Hey everyone, I'm Dr. Barone. Everyone wants to know about Piriformis Syndrome. This is a very well-known problem, and it also happens to be one of the most common problems that I treat. I had 6 patients today with Piriformis Syndrome to some degree. Symptoms of Piriformis Syndrome include pain around your hip and your tailbone, and sometimes pain or numbness and tingling down the leg. So I'm going to explain today the structures that are involved, as well as the related other muscles and problems that we need to consider that may actually cause or contribute to piriformis syndrome. Piriformis syndrome is usually caused when our typical exercises, such as running, cycling, or sports, are followed by sitting for prolonged periods of time. Do any of these activities sound familiar to your routine? Share your experiences with piriformis syndrome in the comments. The piriformis is a relatively small muscle in the back of the hip. The hip is a ball and socket joint, which means it moves in all directions and is stabilized by muscles all around it that need to all behave well in order for the hip to function properly. Ensuring that the hip joint moves in a coordinated way is crucial for preventing long-term damage and maintaining hip health. Have you ever experienced hip pain that you think might be related to your hip movement? Let me know in the comments. 3 things can cause damage to a muscle: hypoxia, or lack of oxygen, sharp tension, or some type of an impact. If you're active, then it's expected that you will create some type of tension in the piriformis, and under normal circumstances, it will heal. The trouble with the piriformis is that we tend to sit on it, which decreases the circulation and oxygen going to the muscle. So this damage, followed by hypoxia, makes it more likely to get scar tissue. Scar tissue leads to friction between the piriformis and the other structures around it, and this friction leads to pain. Once the piriformis is injured and becomes infiltrated by scar tissue, it's very unlikely to get better without treatment. The first thing we need to do is evaluate the other muscles of the hip. The hip joint is located in the axial skeleton, or the pelvis, and all the stabilizing muscles, the piriformis, gemelli, gluteus medius and maximus, the obturator internus and externus, the quadratus femoris, the psoas and iliacus, the sartorius, the tensor fascial, each of these muscles should be evaluated. Your nervous system controls all the muscles in your body, and these muscles maintain the alignment and control the movement of your hips. If you have any interference with the nerve, then this will change the coordination of your body and make it difficult to stay in alignment and move in a coordinated way. Doing so would be like trying to play the piano when it's out of tune. Chiropractors have 7 years of university training to improve the function of your nervous system and correct the patterns in the muscles of your body. The most common area the nervous system is affected is in the spine. This is where just the weight of a dime can significantly change the behavior of the body. The gold standard for improving the texture and movement of the muscles and removing interference in the peripheral nerves is a technique called active release techniques, or ART. ART is the best technique for this, and it's also the most copied and the most bastardized. No offense to bastards. What I mean is that for every practitioner who is trained in ART, there are 10 who say they're trained in ART, but are not certified at all. You can go to activerelease.com and find certified practitioners. In the case of piriformis syndrome, you want someone who is certified in lower extremity or spine or both. ART is a soft tissue technique that's commonly used among mostly sport chiropractors like myself. It differs from massage therapy because with ART we move the muscle through a range of motion while using precise tension between different structures to separate them. Scar tissue in the muscle is like when you have gum in your hair. If you massage the gum, it doesn't come out. That's like what massage does. It may loosen it a bit, but it doesn't come out. Exercise is like brushing it. The brush gets stuck and it's painful and you have to brush around it mostly. But ART is like taking one hair and holding the gum while pulling the hair out. So the structures in your hip, all those muscles, as well as the interfaces between them and the sciatic nerve, and even the ligaments and joint capsule, and even the blood vessels affecting circulation, ART can help improve all of this. As a chiropractor, I believe in helping you to exercise and eat better and reduce the stress in your body. So our first goal is to improve the function of the spine and nervous system. Then we want to improve the texture and movement of the muscles in areas where there's scar tissue. Then We want to remove interference in the peripheral nerves. That's it for today's video on Piriformis Syndrome. I hope you found this informative and helpful. And if you have any questions or need further assistance, please feel free to leave a comment below or reach out to me. And don't forget to like, share, and subscribe for more content on health and wellness.